Today we'll be talking about hearing impairment. What we'll cover today is the definition, types of hearing loss, prevalence, eligibility, learning characteristics, and recommended practices. The definition of hearing loss is defined by IDEA is an impairment in hearing, whether permanent or fluctuating, that adversely affects a child's educational performance but is not included under the definition of deafness. That means any hearing loss below 90 decibels because once you're at 90 or above 90 decibels of hearing loss, it's considered deafness. There's three types of hearing loss. The first is conductive, which is due to issues with the ear canal, eardrum, or the middle ear and its corresponding bones. This can be caused by a variety of things: malformations to the ear infection, allergies, benign tumors, impacted earwax, and infections in the ear canal. This type of hearing loss is not always permanent. However, sensorineural is usually permanent. It's caused by damage or issues with the inner ear, and it is nerve-related. It can be caused by exposure to loud noises, head trauma, disease or virus, hereditary hearing loss, aging, tumors, or otosclerosis. The third type is mixed hearing loss, which is just a combination of the first two types. This chart shows this categories of hearing loss as divided by severity. So you can see minus 10 to 15 decibels is normal hearing, but you get all the way to minus 71 to 90, and that's severe hearing loss. Beyond that, profound, which is also considered deafness in IDEA. Prevalence, 2 out of 3 of every 1,000 babies born in the United States are born with hearing loss. The low incidence disability. Globally, it's a little lower, 1.36 in every 1,000 live births are born with hearing loss. These numbers don't include those that get hearing loss later in life. This is just at birth. Additionally, European and American countries have fewer occurrences of hearing loss in children than in Asian countries. Another good statistic is that children with hearing loss are increasingly being identified at an early age and receiving that early intervention to get resources that they need. And this just shows that the division of the types of hearing loss by severity. You can see deaf is only 3%, while moderate and mild hearing loss make up about 60% of the population in the United States that has hearing impairment. Eligibility is covered by the 3-prong eligibility check that is required for you to get special education services. The first one is they must have a disability or disabilities. The disability would be hearing impairment, as we're discussing. So in order to diagnose this, there's a couple ways. It can be at birth, which the infants are given a couple of tests. This is one of the otoacoustic emissions tests. There's also one called the auditory brainstem response, and these just measure different things with the baby's hearing to make sure they're at normal ranges. Another way to identify is through physical exams, general screenings, and audiometer tests. And these would be tests that would be done later in life if you suspect your child has hearing loss, or sometimes they're just done as general screenings. Additionally, the disability must adversely affect their educational performance. If it's not affecting their school performance, they will not be eligible for special education services. Additionally, their needs cannot be addressed through education in the general education classes alone, with or without accommodation. They have to have a severe need for the specially designed instruction. One way to see if their performance is being adversely affected is through discrepancy analysis. This is a primer where the teacher determines if something is negatively affecting a student's ability to achieve. Basically, if they're performing 1.75 standard deviations below or more standard deviations than the 50th percentile, that'd be a severe discrepancy. Learning characteristics are that the students have the same intellectual ability as other students. It's just a hearing impairment. However, if their intelligence is assessed on language, they may score lower because hearing loss can affect their ability to understand language. Additionally, they may struggle with language-based activities, which may result in a difficulty to read and comprehend. They may miss subtle meanings of words. This can include vocabulary activities, and it can affect their learning and social interactions. Additionally, they may be socially and emotionally immature. They watch and listen to what other children imitate what they say and do, so they're good observers. However, they may miss out on important social cues. Interactions with many people may be confusing, and they may become uncomfortable around people because of this, and this can lead to a lack of social skills if not addressed. Recommended practices, we just have a few here, and we picked out some pretty simple, doable ones that anyone could implement. If you have a student with hearing impairments, you want to face the class. You want to face the student so they can see what you're doing, especially if they're a speech reader, if they have an interpreter. Additionally, use a smart board if possible. Stay in one location while speaking so the student doesn't also have to deal with the sound moving as well as trying to focus on it. And that goes for the second one, have the student near you so your voice isn't getting dispersed. Establish some sort of buddy system so that the student can have a safety buddy for like fire drills and stuff, as well as for classroom tasks such as taking notes during lectures. Taking notes can be a difficult task for students with hearing impairments, so having that buddy to compare notes with and add what they may have missed is a really good idea. Additionally, learn some sign language. The book recommended this one. Said to learn some simple signs such as line up.
Line up. Your hands show a long line of people. You can line up this way, or you can line up this way. Line up.
This can help students
line up.
Have
your hand.
This can help students have an additional cue, as well as make them feel more included, especially if they already know sign language. The last one is to just use technology. There's a lot of things available, such as Captionist, FM amplifiers, microphone systems. So just use what your school has available and just be comfortable with trying new things. And turn on captions while watching videos as well. Thanks for watching our presentation.